likely to have severe or moderate pain, but they're not the only patients with it in a hospital, and I think that's something we always forget.
And that is Sweden in 2010.
Absolutely.
Yeah.
This is yes, and
Yeah.
in fact, I think you could find it in many places yesterday.
Okay.
This slide I rather like because it tells us what we would like to think we know, and now we have the evidence, so we do know it. Essentially, the graph is showing us on the x-axis the percentage of patients treated for their pain, and on the y-axis the percentage with severe pain. And you can quite clearly see that if patients are treated, the incidence of acute pain, of severe acute pain, is less. So if you want to reduce severe pain, treat patients.
Yeah.
This is the Pathos study, which talks to us about, it's a survey of 746 hospitals in 7 European countries. And the respondents, two-fifths were surgeons, 3/5 were anesthesiologists. And these, I'm sorry, are absolutely shocking. So in a third of hospitals, there was no regular staff training for post-operative pain. Only a quarter of respondents said they had specific post-operative pain protocols. And only in less than a half were pain scores documented in a chart. Well, actually, given that a third of hospitals didn't measure the pain at all, you can see why few documented it. This is incredible. And there's no threshold for rescue analgesia. So people didn't know what the pain score meant, when to engage.
Yes.
So I think it's fair to say shocking, absolutely shocking. Can you tell me how the effect of analgesics is clinically assessed and how reliable those measurements are?
Yes, I can, actually. It's very interesting you say that, particularly this business about, not measuring the pain at all. I mean, one of the things that interests me, or has interested me for some years, but I'm only now getting to grips with it, is the idea of whose pain it is. Who owns the pain?
Whose pain is it?
Well, no, seriously, who owns the pain? And it came to me when I was on a ward and I saw a friend of mine being assessed for pain, and the nurse said, "What's your pain?" He said 7 out of 10. And she said, "Well, that's just mild pain. You don't need any analgesics." And I thought, well, hang on just 1 second. That's not like that in real life. I mean, in research, we do things in a particular way. In the real world, things are different. And that was my introduction to the real world. And it's not unusual. This is a lovely, again, Italian survey. They're doing a lot of work in Italy on this, on looking at what nurses scored a patient's pain to be and what the patient said their pain was. Yep. So you can have the two saying the same thing. That would be called congruence on this slide. Okay. And then, of course, the nurses can underestimate the pain, or they can overestimate the pain compared to the patient. And what you can see here is the results in terms of dark blue. This is the important one, is the underestimation of pain in relation to the pain as presented by the patient. And the important thing is, on the right-hand side, with a moderate and severe pain, as described by the patient, was described as mild or no pain by the nurse. And yet, when you think about what we're doing in terms of measuring analgesics, we're going back 65 years, and we knew that it was the patient who had to have the pain. It was the patient who had to score their own pain. So in acute pain, we've been assessing analgesics in a very simple way. These are standard pain models. They've been going on now for 50 or 60 years. They use validated methods. It's got to be predictable pain. So you can only measure an analgesic effect when someone has pain. So you have to have people with moderate, severe pain at the beginning. And as the cartoon shows here, third molar extraction is a good way of doing that. And you can measure pain on a variety of scales. This is showing a Likert pain scale here, or a visual analog pain scale. And just the idea here that if it's below about 30 to 40, it's mild pain. If it's between 30 and 60, it's moderate pain. If it's above 60, it's severe pain. And you can argue a little bit about the grey areas, but that's how it works. Important thing about all this is, what do patients want? Now, I know you know the answer, so I'm not even going to ask you the question here. But if you ask patients with any sort of pain around the world, what do you want? They say, we want the pain gone. You say, when do you want it gone? Now. That's simple as that. So what people want is no worse than mild pain. They don't want moderate pain. They don't want severe pain. And this is as true, for instance, for migraine and tension headache as it is for acute postoperative pain, as it is for neuropathic pain or other forms of chronic pain or cancer pain. And wherever you go, you see the same sorts of thing. Now, I've been interested in this for years, looking at it from the point of view of clinical trial data. And here's some work that we did with 14,000 paired observations in the postoperative state. The top bars there to do with people with pain at rest, and the same people there with pain on movement at the bottom. And you can see the visual descriptors of pain against the visual analog score of pain done at the same time. So people who say they've got no pain score no pain. Those who have mild pain score less than 30. Those with moderate pain score 40 to 60. Those with severe pain, it's above 70. You can see how it works.
Yep.
You know, you don't need a brain the size of a planet to work this one out. This seems to be true wherever you look at it and whenever you look at it. So what do we do in a clinical trial? We're looking at actually the pain itself, but we're also measuring pain relief. People want the pain gone. And you can regard the pain relief as a little bit. That is, in here, for example, less than 15% pain relief, or 15 to 30%, or 30 to 50%, or what people say they want, more than 50% pain relief.
Yeah.
And that's well described. In red, in an acute pain study, you can see what happens. Most people with placebo have got very little pain relief.